Welcome back, everyone. Okay, boys, move over and make some room for the new cast of Dr. 90210 on E. Dr. Kelly Killeen and her crew of powerhouse lady docs are taking Beverly Hills by storm.
Beverly Hills is the mecca of plastic surgery.
This is where rodeo
I want a lady to make me look good.
I love it.
meets drive.
This is going to be life-changing for me.
This looks
Amazing. That's what a plastic surgeon should look like.
So, Dr. Killeen, I was actually a fan of the original Dr. 90210, which had an all-male plastic surgeon cast. So I'm actually really looking forward to seeing this relaunch with an all-female cast. So aside from the obvious, which is all-female, what's going to be different with this show?
Well, I think what's different in this show, there was certainly some behind the scenes and office and home life stuff, but you're going to get a different window into the home life of all four of us. And I think you also get a little bit more in the consultation and the interactions with the patient. So it's going to be a little more meaty with how we as women interact with our patients. And I think that really is what makes us special.
What better person to know us than another woman, right?
Yeah, absolutely. I think, you just have a different relationship with the parts. When you've gone through pregnancy and you've seen what happens to your body, it just is a little more meaningful when you're able to help a woman get rid of the effects of pregnancy. So it is very special, and these surgeries are a lot of fun.
Yeah, and being that this is kind of a male-dominated field, what's it like working in this business?
Yeah, I think it's difficult at first, and I think we do have a certain amount of things that we have to overcome. As a woman in surgery, you just really have to be top-notch to even be considered an equal or okay. And I think you have to put up with a lot of shenanigans that goes on with men that is not something that we're included with, and so you're a little bit of an outsider.
Do you find that you are listened to less because you're a woman?
I think things are different when you're a woman. And I think even female patients, we have a lot of this internalized misogyny. And, when patients have a difficult problem, I'll hear on a regular basis, well, this doctor told me this. Like somehow I should acquiesce and be like, oh, well, if the male doctor said that, then that's the way to do it. And I think that it's just going to be a long time until there's more women in these powerful positions and professional careers where it feels normal to have a woman giving an opinion on something.
Yeah, absolutely. What I find really interesting is that you work with a lot of cancer patients and you're actually able to perform not only a mastectomy, but also insert breast implants at the same time. This is pretty huge.
Yeah, I think, breast cancer is a horrible thing to go through. And our goal as plastic surgeons is to minimize the trauma. We want women to wake up and have it be in the rear view and not be reminded every single day of the horrible thing they went through. And so the way that we do these surgeries now, where the mastectomy and the reconstruction are done at one time, are just life-changing for women because they get to wake up with breasts. And I think that reduces a lot of the psychological impact of losing their breasts. It's a huge improvement.
Do you ever come across a patient, though, that wants something so badly, but in your heart, maybe this isn't the right thing, it's just not safe? Do you just make them happy because ultimately you want the patient to feel, self-confident and they want to be happy? Or do you really advise against whatever it is that they want?
I advise against whatever they want. And I give them the big sister talk that if you were my sister, this is exactly what I would tell you, that this is Beverly Hills. If you wave that credit card around, someone's going to take it. So, this just isn't the right thing to do. And often patients that want something that's so off the wall and wrong, there's something much deeper going on than what they're asking for. So I love psychology. I think the most fun part of my job is interacting with people, figuring out what makes them tick and getting to the root of the problem. And with those patients, I may not be the solution, but I can often help them get there.
Well, thank you so much, Dr. Killeen. You can catch Dr. 90210 Mondays on E!
coming up, Mr.